My name is Startila Wright, and in this video today I will be going over prenatal care. So the first thing that I'm going to do, just as any visit, I would go ahead and enter the room and introduce myself to my patient. From there, I would go ahead and perform some type of hand hygiene by either washing my hands or applying hand sanitizer. I would then go on to identify my patient using two different patient identifiers, such as name and date of birth. And I would also ensure privacy by closing the door or curtain behind me. In this visit today, again, like I said, we will be going over prenatal care. So I would just start by informing the patient what they can expect at these type of visits. So for the first 4 to 28 weeks, they should be expectant to come to see the doctor at least once a month during that time. From 24 to 36 weeks, they can be expectant to come in about once every 2 weeks. And from 36 to 40 weeks, they should be expecting to come in at least once a week at that point. That is in the third trimester. During these visits, the patient would be expectant, they could expect to have their vital signs taken, focusing on their blood pressure, having their weight taken, monitoring the baby's strength and their heart beat. And the heart rate, just measurements of the baby, things like that. They can also be expecting to have ultrasounds, to have some type of imaging of the baby. And during 24 to 28 weeks, that is when the glucose testing will be done. It's an oral solution that they will be intaking, and that is going to monitor for gestational diabetes. Moving on, I would go on into nutrition. I would encourage the patient to eat a well-balanced diet, stay away from foods, snack foods especially, that are high in starches, added sugars, added sodiums. I would advise them to stay away from those foods and eat a well-balanced diet. Things that have calcium and vitamin D inside are always good during pregnancy. I would encourage my patient to take her prenatal vitamins as a form of supplement that's folic acid inside, vitamin D, calcium, things of that sort. From there, I would move on to exercise. For exercising, I would highly encourage my patient to stay active, keep her mobility level up. If as far as like going for a walk at least 3 times a week, I would encourage her to stay away from heavy exercises such as weightlifting, things of that nature. I would also encourage her to partake in some type of stretching during this time. Yoga is good. That can help with delivery. As far as weight gain goes, I would advise my patient to keep her weight gain between 25 to 30 pounds. I would not exceed 30 pounds. That is kind of going over in pregnancy. She should not be gaining more than 25 to 30 pounds during her pregnancy, and just keep a normal BMI between 18.5 and 24. That should be the range of BMI that she holds on to, not going above or below that. And just monitor herself for rapid weight gain. In that way, contact her physician if she's experiencing rapid weight gain or rapid weight loss. Some things that are normal complaints of pregnancy would be nausea. For nausea, I would advise her to go ahead and intake some ginger, maybe in a tea, or they have ginger chews for nausea if she wants to go the non-pharmaceutical route. Another complaint would be edema in the feet, swelling. I would recommend that she stay away from foods that are high in sodium, and also just keep the feet elevated. That can help bring down some of the swelling. Another complaint would be cravings of sweets. I would encourage the patient to have more natural sugars such as fruit, and stay away from cakes and redefined sugars in that way. Some type of warning signs that they should look for out in pregnancy would be first bleeding. That can be an indicator of miscarriage, as well as severe abdominal pain. That's another indicator of miscarriage. And also high blood pressure, dizziness. Those can be indications of preeclampsia. So after that, I would just kind of wrap up with my patient, ask them if they had any further questions, and maybe just send them home with a pamphlet of the things that we discussed for that day. and just let them know to contact the clinic at any time if they had any further questions. That concludes my video.